Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. Today, I'm joined by Rafid Fadul. He is the CEO of Zivian Health, a platform that helps organizations scale NP and PA workforces quickly and compliantly. Thank you for joining us today.
Thanks for having me, John. Appreciate it.
Absolutely. And do you mind just kind of telling us a bit about your background?
Yeah. So I'm a pulmonary critical care physician by training, by way of Cleveland Clinic in Georgetown, and I've been in the health tech space since 2009. My journey was after I left Cleveland Clinic, I started a health services company that sold back into the health systems. We did, pulmonary critical care medicine and post-acute care. That was later acquired. And then I went kind of deeper into health tech and was working at a company called Wheel, which is a digital infrastructure company. And then stepped down from there, was back in the intensive care units during COVID for obvious reasons. And all three of those experiences really kind of formed the thesis around why Zivian needed to exist and why we started it. And so just at a high level, and I'm sure you probably already know this, but we're experiencing this very quiet but massive crisis in the healthcare staffing world. Physicians like myself are dwindling in number, but the care gap is growing. So who's filling in that gap? It's actually non-physicians. So, NPs, physician associates, in some cases, pharmacists, RNs, you name it, which is great. But the problem is there is no real robust infrastructure to support these folks to take on these roles. And that's where Zivian steps in.
And what are you finding with your clients where they really find a lot of value working with you as far as like what solutions you provide specifically?
Yeah. So we started with compliance first and foremost. Why? Because compliance is kind of this messy area that no one likes, but if you mess, it can ruin your business. So
yeah, exactly.
It's super important, but it's not really core to what you're offering. Like what you offer typically is clinical care. So we start with compliance first, and that's really, doing things in a highly compliant manner is built into our ethos. And from there, and that serves as a great unlock in terms of, capacity and creating access for patients. But then the next thing you move into from there is now quality, right? So we're looking at like evaluations, education. Really where Zivian aims to be is really kind of like a definitive workforce management tool. So we do licensing, we do credentialing, payer credentialing, anything to help activate the workforce faster and then make them better in the process. That's really where we're at.
Yeah. And what, if you don't mind me asking too, what are people saying about working with you? I'm just curious on feedback.
Yeah, feedback's been good. I mean, we're very privileged. We have a lot of great partners that they kind of show their roadmap to us and say, look, here's where we're trying to go. Here's what we need help with. And I'm very lucky that we have an amazing team. I'm happily the dumbest guy on the team. And so we have people working to create solutions that support these companies, these providers, and by extension, what I call the invisible stakeholder, their patients.
And when you're looking at your role specifically as a CEO right now, like where do you spend the most energy kind of driving your growth day to day?
That's a really good question. I think, when you're the CEO, you wear every hat, right? So you work a little bit in the product, you work a little bit on HR, you work a little bit on everything, BD and sales. And so I think when it comes to growth, really getting the word out, like I think there's a bit of an education problem out there, right? So people don't know that an easy button for compliance exists. And so getting the word out is number one. And then number two, like that really pivots towards kind of the upskilling, education, evaluation functionality that we have. And so exposing our features to partners, channel partners, organizations, societies, like American Hospital Association or AAPA or AANP. I think sharing our visibility into what we're building. We have both a marketplace where we have, physicians who provide services. And then we also have this SaaS solution, software solution that really aims at workforce management and workforce enablement. So building those partnerships and those relationships to kind of create that exposure. And also it's a feedback loop, right? Like I want to hear from them, what are their pain points so that we can help build towards that and solve together.
Yeah, it sounds like make adjustments and grow from there just to keep on getting better.
Exactly.
Yeah. And then looking at like an industry perspective, like what's one shift in this industry that most leaders are not paying enough attention to? I think specifically because you're focused on providing those gaps like NPs and PAs. That's a really niche solution. Is there something specific within there that they just may not be aware of or something you want to provide insight on?
Yeah, I think a lot of people don't appreciate how much of a labyrinth the compliance piece is. It varies on a state by state basis. Even within the states by provider types, it varies, and that constantly changes. The rules are always evolving. And I think a lot of people are kind of flying blind right now, and they just don't understand they actually have a significant amount of exposure. So I think like that's probably the piece that's overlooked the most. And I've heard of other companies kind of talking about compliance, but like it's a pretty superficial thing. You know, we're lucky we have, you know, kind of deep healthcare or regulatory expertise within our team. And so, you know, we stay ahead of the curve with that. But knowing kind of the implications of not being compliant I think that's probably the place that most people are missing, I think.
Is there something you see trend wise with compliance that a lot of people may miss as you're working with your clients or may not be aware of? I'm just curious about that as well.
Yeah, you know, like a lot of people come to us because. So I'll give you an example. You know, again, we have this care gap, and also physicians are more expensive. So it's not uncommon that the larger proportion of the workforce is, say, NPs or PAs, and companies will hire them, not realizing that, for example, in almost all states, PAs need a supervising physician, and the same thing is true in the majority of states for nurse practitioners. Oftentimes they don't know that before they hire them, and they thought they could have what's called independent practice, and that's unfortunately not the case everywhere. And so you need to actually have by law a supervising physician contractually obligated to sign off on this provider's performance. And so they think they're activating supply because they've hired 5 NPs or whatever, and then they come to find out that no, you can't actually put them to work yet. You have to solve for this supervisor situation first. So, we get a lot of companies that come to us missing that entirely and saying, "Hey, fix this for us." And so we provide them. Again, this is where our marketplace comes in with collaborating physicians. We provide all the regulatory paperwork. We document it all, create audit trails, do quality oversight, and then do all the renewals on an annual basis or sooner if necessary. So that's I think a lot of people don't know that stuff exists until they kind of get into it, and then we are a fast fix for that gap.
And then you kind of alluded to at the end there. What happens if these hospitals or small clinics or private practices don't adapt to this compliance, or maybe it's something they just don't know about, but they're like, I guess, how would they know it's an issue otherwise? It's kind of the question, you know.
Usually what ends up happening is you get a letter from the board. So
That's what happens. Gotcha. Okay.
And that this is also another reason some of our clients come to us is that they didn't realize they were out of compliance, and they received a letter of inquiry from the board or a letter of reprimand saying cease and desist.
Okay.
And they come to us to help remedy it. And obviously we're happy to do that. Our preference is that they don't get in that situation in the first place, but we're happy to help them out if they're there.
That's excellent. So you're more proactive, and also in the moment, it sounds like you're able to provide a solution as well to help guide them out of that as well.
Yeah, exactly. I mean, at the end of the day, these companies are looking to provide access to care, right? Like that's ultimately what they want to do. And of course they want to make a profit as well, but like they're trying to do a net good. And our goal is to try to simplify this labyrinth, this maze of regulatory, burden that exists on a state by state level, so they can do what they want to focus on, which is, take good care of patients.
Yeah. And when you're looking, closer within, Zivian Health, I know you're at a pretty good size now. Are there things moving slower than you'd like to see growth wise, or are there any barriers or bottlenecks you're running into at this point?
That's a loaded question because if you ask any CEO, nothing is moving fast enough. And then you pair that with me, which is the most impatient person on the planet, and literally nothing moves fast enough. So, I mean, look, we have like brilliant minds on our team who are hearing discovery from clients and innovating on new solutions. I'd love those solutions to be like overnight solutions, but obviously, like, to build it right takes a little bit of time. So that's where we are now. Where we have a very formidable engineering team. We just brought in an excellent new product leader with great vision, and so we're in a very good place. Zivian continues to thrive, and we're excited about new solutions we can bring to the table tomorrow and the day after.
And when you sign on a client as well, kind of walk me through the process. Like, how do you keep them engaged throughout the process to make sure they're getting the results that they want, but also that you're getting the information that you need to provide a good solution?
Yeah. So the information is key. So, on day one, essentially, we're really in the sales cycle. We're getting as much information about them as possible, even before they've signed. Once they've signed, we go through, we've kind of leveraged what we already know about them. And then we begin a pretty data intensive onboarding process that looks at their workforce. And then from there, really, we have a very close hand on them with our account management team, where we stay in constant touch, helping them grow. Our clients actually grow pretty significantly over time. They almost X over the course of the year.
Wow.
Classically. Yeah. So they're growing in size, they're growing across service lines. And so, in our job, so we're in steady communication with them because we're helping them activate every time.
And then looking further within your team, it sounds like your team's working really well. You've hired some more people. What's working really well right now that you would never want to lose?
That's a really good question. What's working really well right now? I think right now there's a really good energy around the mission. It's sometimes it's easy to get like really burned out. And if you're down in the weeds and you're just, just like, oh, I could be really granular and be like, oh, I'm just like pushing compliance paperwork, which doesn't really feel fulfilling, you know,
Yeah.
when you put it like that. But when you think about, oh, actually we're building something that's going to create access for patient care and also going to improve the quality of that care that's being delivered, all of a sudden, like it's a lot more resonant with purpose. And so, and right now, I think there's a lot of that going on in Zivian. There's a lot of energy towards the greater mission of what we're solving for, and that alignment gives you the extra energy on the tough days and the tough weeks to kind of keep on pushing through. So I would say I don't want to lose that energy. That's the thing that we have right now. That kind of carries you through everything.
Yeah. Especially through those times, like you said, you have good days and bad days and get through it, right?
Yeah.
What's been harder than expected despite all the effort that you've put into it as you're working through this process and growing your business?
That's a really good question. So what's been harder than expected? So I'm a non-technical founder. Obviously, I'm a physician by training, and we're building a software company. So, I don't know what I don't know, but I also know that I'm very impatient. And so,
Yeah.
uh, and so I'm like, why can't this be built in 10 minutes? Like, I think that's the challenge that I have is covering my own knowledge gap. Right. So there is an asymmetry of information between, kind of the technical folks and the non-technical folks. And so covering that gap so you can understand what the inputs are, timelines that are realistic, et cetera. I think that's super important for any non-technical founder to do.
And then, looking in the future too, as well, like where do you want to be in 6 to 12 months?
Yeah, that's a good question. So today, the large portion of our clients, I would say, are about 60% of it is virtual care, about 40% is traditional healthcare. And with respect to our compliance offering, that's really resonant with anyone who's multi-state, which typically lends itself towards like venture-backed offerings or even PE backs. The next suite of services that we are rolling out is really aimed at not just that customer segment, but also more traditional healthcare. So I see us, in 6 to 12 months doing more of that. Knock on wood, we've had tremendous growth every year. I'd like to keep that pace up, keep that streak up. And then, from there, like I see us really, people ask me like, where's the future of Zivian? And I jokingly tell people we're the offspring of LinkedIn and Rippling for healthcare, right? So that's kind of where we're going to live. Is ideally we are, the definitive workforce management tool that helps enable and support all healthcare workers, not just NPs and PAs. By the way, like we built our platform to be agnostic to all user types, so all allied healthcare professionals can work and actually have very similar needs. And then also just be a definitive aggregating place for healthcare. If you look on LinkedIn today, you don't see doctors. You see guys like me who are like working in tech and in business, but you don't see your neighborhood pulmonologist, right? And if you do, it's there's no photo. Maybe there's one connection, and the last time they checked in was like 5 years ago, right? So there's no engaging place for healthcare workers across the board. It's all allied healthcare specialists. We would like to be that place because, frankly, in order to be a great workforce management tool, you need a lot of the same functionality in order to be a great, let's say, a LinkedIn version for healthcare, right? And so
Yeah.
that's kind of where we're at. We want to aggregate and be a tool that's of value for not just the providers, but the institutions that employ them.
Yeah. Where can people find you to connect with you and learn more about yourself and Zivian Health?
Yeah. So zivianhealth.com, Zivian health.com. That's our website. And you can reach me at Rafid at zivianhealth.com as well. Yeah. I mean, we're excited to be a part of this ecosystem. I mean, I've been involved in the space for now 16 years, which is wild to say out loud. It's every year gets better and better, and we see a lot of innovation, and it's humbling that we get to be a part of that. So yeah, I'm happy to chat with anyone who has any interest.
Excellent. Well, thank you for your time, sir. It's been a pleasure to have you.
Appreciate it, John. Thanks so much.